Hi, this is Dr. Salil Kandwala, Medical Director at Advanced Urogynecology of Michigan, and let us talk about the value of your history forms. So yeah, when my patients get the history packet in the mail or we send them electronically and they say, "Oh my God, are you kidding me? You want me to fill up all of that?" Well, let me tell you, this is very important. I'll explain to you why it is so important. You have to include your complete list of medications with doses and frequency. Make sure that you put the medications all together. So if you're taking blood pressure medications, put them together, not all over the place. State your allergies and also what is the reaction. Sometimes people will say, I took ibuprofen and I had some GI upset. Well, that is really not an allergy per se. Surgical history with the operating reports, especially if you've had a previous leakage or incontinence surgery or a prolapse surgery, and information of your doctors. Who is your primary care physician? Who sent you to us? And who are your specialty doctors? If you have a cardiac stent in place, then who is your cardiologist? A proper history is, in fact, the first step of your treatment. Without a proper history, you can get medical errors. And in fact, one of the main reasons for medical errors is when patients do not give us proper history. So an incomplete list of medications then can lead to drug interactions. Sometimes you are taking a medication and you don't tell us about it, and then we take you to surgery and you start bleeding. Or allergies. You don't tell us about a particular drug and we give it to you and now you have a major reaction. So, for example, a patient presents with urge leakage, the overactive bladder, and she is on Aricept, which is given for early dementia, but she doesn't put it on the list. And starting her on an overactive bladder medication, which is exactly opposite to donepezil, it works opposite. This is a cholinergic, this is an anticholinergic, can cause an unnecessary drug reaction. Patient who presents, let's say, with bladder pain syndrome with urgency and frequency, and she's taking doxepin as an antidepressant, but she did not put it on her medication list. And if we say, okay, let's put your amitriptyline, and the amitriptyline and doxepin together can cause a severe reaction called serotonin syndrome, which could land you in an ER. So that is why it is very, very important that you give us the right information, the complete information in detail. So we don't have to go hunting. Sometimes patients will tell us, oh, look at my chart, look at my records. That is a risk because all the information may not be there. So you must make sure that you have it, you give it to us completely so that we can follow through properly. We also give you what is called questionnaires. And what are these and why do we give them? These are well thought of forms and what's called validated that have been tested and retested for that particular disease state. And they address not only the pelvic floor condition, but its severity, how much it bothers the patient, and how much it affects her quality of life. And we give a lot of questions about these, and I'll tell you why each one is given and what is the value. And ultimately, we have you fill up your goals and expectations. See, that's very important. What are your goals? And then are they truly possible, or what are the expectations? So the MESA form is a form that looks at the urinary symptoms, as to the urgency and the stress incontinence. It's broken down into two parts, the urge leakage score and the stress leakage score. So you mark it here. Let's say, do you lose urine when you suddenly have the feeling that your bladder is full? Question number 3. And you put sometimes, you circle 2. Then we'll add that up, divide by 18 in this case, and come up with a percentage. Here we add up, divide by 27, and come up with a percentage. So it gives us the percentage and the total score, and therefore allows us to see which symptom or which condition is more bothersome, especially if it's both stress and urge, which is what is called the mixed urinary incontinence. The other form, which is very important, is a sexual function questionnaire and its impact of these pelvic floor conditions on sexual function. It looks at pain during sex, is there any urine or bowel leakage during sex, and any vaginal bulge and orgasm. So there are many factors it looks at which are very important. Sexual function is an integral part of a woman and a couple's life. It's affected by all these conditions: urine leakage, bowel leakage, vaginal bulge, pain in the vagina, and menopausal atrophy. So this form helps us understand impact on these sexual functions, and affects both, not just the patient, but even the partner and it is affected by these pelvic floor conditions. And it helps us assess if there's a benefit of correcting the pelvic floor conditions on sexual function for both partners. That means there is urinary leakage. Now we correct it. Did that also positively impact the sexual function of both the partners? And it helps us understand why a patient may not be having sex. Is it because of pain or discomfort? Is it urine leakage or fear of, or a vaginal bulge? And she said, absolutely, I don't want to have sex with this thing coming out. This form is invaluable as it is difficult for a woman to talk about these conditions and easier for her to note it down on the form. The other form that we give is something called Pelvic Floor Distress Inventory, or PFDI. And that looks at questions about a vaginal bulge and how bothersome it is, questions about bowel leakage and how bothersome it is. Same thing with urine leakage and pain. So it asks not only if it is present, but how much it is bothersome to the patient. And then it helps us assess the symptom improvement. Let's say we do it before the PFDI and after, and we see before she says, yes, I have a bulge and it was very bothersome. And now she says, yes, I have a bulge, but it's rarely bothersome. Or she says, I have no bulge. So this fact is very important, because remember I mentioned in the previous video that the initial goal could be help me with my urine leakage. But when they fill this up, they say, oh, wow, they're asking me questions about the bowel. And I do have bowel leakage, and that is very bothersome to me. So now her revised goal after filling the form is bowel issue is more bothersome. I would like that fixed first. If they had not got this form, they would never have been able to address the bowel problem. As I told you, even though I say I'm not a urologist, people still think for some reason I'm a urologist. I'm a pelvic floor specialist. Now we look at the impact. This is quality of life. How much does urine leakage or the bowel leakage or the vaginal bulge have on her household chores, on physical activities, on going to a movie or social activities? And how much does it frustrate her? So this is the true picture. Not only that a condition exists, and not only is it bothersome, but how much it's affecting my day-to-day normal routine. So that is what it does, gives us an idea of the day-to-day routine, and we then compare how the quality of life was before treatment and how it is after the treatment. The PUF questionnaire, the pain, urgency, and frequency questionnaire, looks at the frequency of urination. Is she going 7 times, 11 times, 15 times? Looks at pain associated with it and urgency associated with it. This is usually given for women with bladder pain syndrome who have a lot of urgency and frequency, and if they do not go, it causes discomfort and pain. And a score of greater than 15 is highly diagnostic, and it helps us to compare. Before it was, let's say, 22, and now after treatment, is it 5 or what is it? So remember this. These validated questionnaires are very important. 80% of patients, 80%, I'm not exaggerating, who come to our office with one condition, let's say urine leakage, because of these forms, they also have another problem, bowel leakage, or they come for bladder urgency and now they have pain during intercourse because of menopausal changes. Validated questionnaires address several domains of this healthcare and help us uncover medical issues that may have been considered part of aging. And patients may think, oh, urine leakage just happens with age. Discomfort during intercourse is expected, and gas leakage is going to happen. But when I give these forms and they say, wow, the doctor is asking me about these, and they write it, very bothersome, and then we address it, we talk about it, and help her with that problem, it's worth it. So they are systematic questions that can be tested over time. How was it before? How was it after? In fact, so we can compare. Let's say the before was very much bothersome. Now it is very little bothersome. You can see the change that has happened over time with the treatment. The FDA is stating that just what the doctor thinks is not good enough. What does the patient think? How much is it bothering her, and how much is it bothering her quality of life? That is very important. She cannot leave the house because of urine leakage. She does not want to have intercourse because of the vaginal bulge and passing of gas. And that is affecting her quality of life. So please, it's very important to complete the entire history packet, front and back page. MyChart us when you've done this, and we shall not compromise your care, as an incomplete history form will increase the risk of doing that. So we have a team at our office who can help you in case you have some questions. but make sure you reach them sometime in advance so they have time to help you before your visit. And we shall not assume that your medications are an epic. So don't come and tell us that, oh, it is an epic, look at my doctor's notes. No, you have to write it and bring it. Anything else is unsafe for your health. My personal policy is very strict. I care for you as my patient, and I cannot allow your care to be compromised. We pride ourselves in providing excellent and safe care. Incomplete history forms will increase the risk of errors. So listen, if your forms are incomplete, your appointment will be canceled because it'll delay the other patients if you don't, and if you're filling up in our waiting area. So that's not going to happen. So please remember, we have a great team who can help you fill this and way in advance if you need help. But fill it properly. It's not for me. It is really for you. And because your healthcare will get compromised if I don't have the right information, and I may give you the wrong medication. It's actually the correct medication, but it interacts with some of your drugs. And if I don't know the whole picture, I'll make a mistake. So I don't want to do that. Nor do you want me to do that. Now that we've talked about this, we talked about the value of history, and I cannot stress enough the value of history. Let me tell you a little bit about our urogynecology exam. The urogynecology exam is not like your pap smear exam. An improperly done pelvic floor exam can lead to a wrong diagnosis, wrong management, and then your treatment will fail, or we will do incomplete procedures. So let us understand, why do we do this, a thorough examination, and I'll explain you in the next video what exactly this examination is.